Hello, my name is Jackie Kirkup. Welcome to Spotlight on Souris. Today is Wednesday, May the 21st, 2025. I have with me here this evening paramedic Hayley. Welcome, Hayley.
Thank you.
Hayley's a paramedic here in Souris, so we're excited to learn about your career. So can you walk us through the role of what happens when you get a call from dispatch to the hospital transfer?
Yeah, so basically we'll be likely in the office or we'll be on the road somewhere, and then we'll dispatch, which is basically a branch of 911. They'll let us know that there's a call in the area, and they'll give us a priority number. So the priorities are from 1 to 5. So 1 is like the most emergent, 5 is the least emergent.
Okay.
Yeah, and then they'll tell us where we need to go.
Right.
And then also ask us if we potentially need any other resources, like a second ambulance or even potentially stars.
Okay.
Yeah.
Excellent. So they certainly give you lots of information to sort of make those decisions on the fly, really.
Yeah, it's pretty much the job. It's a lot of decisions on the fly.
Absolutely.
Yeah.
I know you take an incredible amount of training to become a paramedic. Can you walk us through what that looked like for you or what it would look like for others?
Well, right now, to become a paramedic, it's a 2-year program.
Okay.
There are several programs in Manitoba. There's the Red River College, which offers the 2-year program, the Criticare Academy in Winnipeg,
okay.
and Brandon, we call it MESC, or Manitoba Emergency Services, something. Yeah, it's the Fire College in Brandon.
Oh, I see. Okay.
As well as Elite Safety, which is a brand new program that started last year,
Okay.
and it has shown real promise. So.
Excellent. And so what are some of the courses, say, well, anybody, but I'm just thinking about like students in grade 11, 12, like if they're even thinking about this career, what should they be taking for courses?
So if you're in high school, having your biology is really great. It's a great stepping stone. Having chemistry is even better. As well as it's grade 12 English it's a mandatory requirement.
Okay. Yes.
And as well as after that, you'll probably need anatomy and physiology.
Okay.
So different programs have slightly different requirements, but most of them at this point require anatomy and physiology, as well as like medical terminology. You need a Class 4 license.
I was just about to ask you about the license.
Most people have Class 5.
Yes.
So Class 4 is basically the ability to drive an ambulance or a large bus.
Okay.
Yeah.
Okay.
And as well as you need to be updated on your CPR as well as immunizations.
Right. And though, like say CPR, for example, that would be a reoccurring something you have to do every year?
Yes. As a paramedic, we get retested every single year, and we have to be recertified every single year.
Yeah. Wow. There's a lot to know and learn.
Yeah.
Yeah. And what about just the medical procedures and protocols? Like those must be changing all the time.
All the time. It's a bit of a game of catch up.
Right.
But our managers and our the region is really good at keeping us up to date.
Okay.
They send us regular emails about any changes that are happening, any advancements that might be happening or coming in the near future.
Right.
So we're always up to date on that. So it's
excellent communication needs to be happening, right?
Yeah.
Awesome. So what are some of the essential equipment that you carry in the ambulance and on yourself maybe as a person?
So obviously we have the normal things you think of, like oxygen, medications. We have a defibrillator, like an AED, or it's also a cardiac monitor.
Okay.
As well as radios.
Okay.
And then on our person, we actually carry scissors. They're really sharp scissors, and they're meant to cut through really thick pieces of clothing.
Okay. Wow, you just pulled those out of there like nothing.
Yeah.
And clip in right into your belt.
Yeah, and a lot of, we have them on the truck as well. Different medics have different scissors, but I like these ones. So.
Right. Okay. Yeah. Excellent. We have some questions here. I'm just gonna move along to the next page here. So excuse me while I do that. You probably know what the next question is. So how do you coordinate with other emergency services like the fire, the police, the hospital staff? How does that all happen?
Dispatch is our best friend.
Of course.
They're the center of it all. So they are really the ones that are they make the most decisions when it comes to allocating resources.
Okay.
So, but if we were to go to a call and let's say it's a traumatic call and we might need a higher level of care, we might consult with STARS.
I see.
So we would call our higher level of management.
Right.
They're a group of doctors, nurses, respiratory therapists, advanced care paramedics,
Okay.
and they are all a big group, and they kind of decide amongst each other is like where is the best place for this patient to
see.
go and like who we might need. But yeah, dispatch is kind of the center of it all. So they will allocate RCMP as well as fire and EMS.
Okay. Wow. Big jobs all around.
Yeah, we love our dispatch.
Yeah. What are some of the most challenging aspects of being a paramedic, do you find?
Well, the calls can be long and quite stressful at times, but of course it's important that we stay calm and for our patients and make sure that they can trust us and have confidence in us. And we also have to be able to compartmentalize very well,
Right.
So that we can give you the best treatment possible.
Yes.
And frequent check-ins with our coworkers is always very important for our mental health. Mental health is becoming more and more talked about in
Yes,
EMS.
absolutely.
And we're finding now that it's better for us to have the resources and to access those resources
Yes.
as these things come up.
Right.
So, but of course, everybody deals with these calls in their own way. So,
Yeah, for
Yeah.
sure. Well,
Yeah.
good. It's good that there are some, resources, and that's important because we need you as a paramedic to be on your best game every time you come out,
Yeah.
right? So,
and another thing is we don't really know what we're going to until we get there.
right.
Sometimes situations can be quite dangerous.
Yes.
And that's where RCMP or Manitoba First Nations Police comes in.
Okay.
They'll often help us to clear the scene so that it's safe for us to go
I
in.
see.
So everybody is safe.
Right.
So,
Right.
yeah.
What advice would you give to anyone that would be considering this type of a career?
Well, first and foremost, having the attributes of being compassionate and caring, those are two big ones.
Right.
But as well, it's what you can do is ask around to your local station, maybe ask if you can have a ride along.
Okay.
Just inquire. There's nothing
Right.
wrong with asking. Of course, it depends on staffing issues and all that. But
Absolutely.
there's no harm in asking.
Right.
And we are happy to educate whoever is interested and potentially give them a look into what being in a paramedic looks
Right.
like.
Is there a shortage of paramedics in, say, like this region or Manitoba, or is it like a nationwide?
I don't know about nationwide, but Manitoba is very short of paramedics right now. So if we have a station in Souris, but we're not always here.
Right.
So because we might get sent elsewhere, we're kind of more needed, or like we're kind of closer to filling the hole, so to speak.
I see.
Yeah, so, but we are around.
Right.
So,
Yeah, of course.
Yeah.
Okay. What are some of the things that you wish the public better understood about the aspects of your job?
well, we are not just ambulance drivers.
Did I say? I hope
No,
I
you-
didn't
no, you
say
didn't.
that.
You're okay.
Okay,
A lot
good,
of
'cause
people call us
I-
ambulance
you-
drivers,
yes.
but it's the fact is that we are a rolling ER. We bring the ER to your home, and we are capable of delivering babies and handling trauma situations.
Right.
And if you're having a medical crisis or even a mental health crisis,
Right.
we're trained on how to deal with all
Wow.
those things at your front door.
Wow.
So, and then from there we bring you to the hospital for a higher level of care.
Right.
So it's not just a pick up and drop off situation.
No, absolutely not.
So,
No. Are there any other common misconceptions about paramedics that you would like to correct? So we talked about we're not just a pick up and drop off.
Yeah.
Are there some other things, or did we
yeah.
kind of catch that with that?
We kind of did, but
Okay.
another thing is what a lot of people don't know is we actually have a couple levels of paramedic.
Oh, okay.
So we have what's called an emergency medical responder. We don't have a lot of those right now. They've kind of been phased out, but we
I
have
see.
a lot of primary care paramedics,
Okay.
which can do a lot of things like give pain medication and monitor traumas and stuff like that.
Right.
But we also have intermediate care paramedics and advanced care paramedics,
Oh,
which are
okay.
being introduced to the region. Yeah.
I personally did not know that.
Yeah, it's still in the works. It hasn't
Yeah.
quite been established yet, but it's they're well on their way to
Right.
making that happen.
Right.
So
And of course, I think about, when there'll be more training to become those things, or is it
that is additional
a
training.
combination of experience and training to get to
Yes,
those
you're
levels?
right. Yeah, it's an
Okay.
addition, like you need at least 2 years to become an advanced care paramedic.
I see.
So yeah.
Okay,
Yeah.
goodness, wow, there's definitely a lot of things for sure. So what, as a bystander, what could they do to assist or do when you arrive on a scene?
Or even before we arrive.
True.
Most important thing is stay calm. Stay calm, be present with the patient or whoever's in trouble, but also keep yourself safe.
Yes.
If you're on a highway and there's somebody that's been hit and you want to help them, you have to make sure you're safe first.
Right.
Otherwise, we're coming to 2 patients, not
That's
one.
right, yes.
So if it's not safe, just let 911 know that you can't get to them because of whatever the situation may be.
Right.
But the important thing is keeping 911 up to date if any changes have happened. So if that means calling them back, that's totally fine.
Right.
Because they then update us as we're on our way.
Okay.
Yeah.
Okay.
And then just if you're in a rural area or your location is hard to find, it's great if you can flag us down from the end of the driveway or whatever. That's always helpful. Then we know where to go. We're not just driving around aimlessly.
Right, right.
Yeah.
Okay.
And then big thing is make sure your doors are unlocked
Right.
and your pets
Okay.
are put away.
Okay.
I completely understand if your dog is friendly, but sometimes dogs get in the way.
That's right.
So
Yes, and
yeah,
especially
it's-
when people are moving around fast and
Yeah.
needing to do
and we don't want to
things
step on your dog
for
or
sure.
your cat.
Right.
So,
Yeah. What are some simple things that people can do to make their homes safer? I guess thinking about upon your arrival, or even like before. I guess I'm not really asking that
That's
question
okay.
very
No,
well.
I'm catching what you're saying.
Okay.
Making sure your sidewalks and driveways are clear. Our stretchers are very hard to push through deep snow.
Right.
And it's also just a safety thing. So we don't slip, you don't slip, all that kind of thing. Make sure your lights are on, especially at night.
Okay.
Your doorways are clear and unlocked.
Yeah.
And making sure your address is clear.
Okay.
We typically prefer the numbers on the doors or
I see.
on the houses
Okay.
rather than written out, but of course that's just a personal preference.
Right.
But making sure that's all visible and clear for us to see.
Right. Makes sense.
Yeah.
Yeah. You're not going to say, or we're not going to tell you we live by so and so. Don't you know where they live?
Yeah,
Because you
unfortunately,
live
we don't
here
know everybody in
right?
town,
So
yeah.
it's
And,
the street numbers and those kinds of
Yeah.
things.
Or if you don't know the address you're at, the closest address is great too.
Right.
Yeah.
Okay.
And if someone in your home or that person that needs help has mobility issues, always have an escape route planned.
Okay.
Inform 911 whenever you call so that they can plan appropriate resources.
Right.
So that we're aware, like if all of a sudden it's somebody that's a little bit heavier and we'll need more people, then we have to call the fire department or
Right.
whomever.
Yeah.
Yeah.
Okay. Good to know. And when in the remote areas or more rural areas, what are some things that people can have on hand in their homes, to say if they had an accident and they were still waiting for the paramedics to arrive and they needed to, stop some bleeding? Like,
Yeah.
what are some simple things that they could maybe
So
have in their home?
with regards to bleeding, put pressure on it. Like if you
Okay.
have a clean cloth,
Yes.
clean dry cloth, just put it on the wound, keep pressure on it, and if it doesn't stop bleeding, then obviously we'll deal with it when we
Right.
arrive. But having a first aid kit at home
Yes.
is always a good idea.
Right.
Having a list of your medications is
Okay.
extremely helpful, especially if you're older and you've got a lot of medications.
Right.
And it's also good to know what they're for.
Okay.
Because unfortunately, we're not geniuses in that. We can't know everything. So it's good to know what these medications are for, because we can't
Right.
memorize every
That's
single
right.
medication.
Right.
Yeah, and then just when you call 911, just give as much information as you can.
Okay.
Yeah.
I just think about rural addresses. It is not necessarily the section, township, and range address that you want. You want the number address. What is that called? Is it the
It's called
civic
civic addressing,
Okay.
yeah.
Okay.
So it really depends on the person.
Okay.
I should say all properties now have civic addressing rural.
Right.
But a lot of people still only remember their section township range. Now, we can still find you with a
Yes.
section township range, but having said that, civic addressing is more up to date, and it's a more specific.
Right.
Then it's easier for us to find with a civic address.
Right.
But we will accept section township range.
Right, of course, yeah. An address is an address, and we can kind of maybe narrow down what we need to narrow down to get to the home. Yeah. I just was thinking about the ERIC kit. I don't know too much about the ERIC kit myself, so what is that all involve?
So a lot of our seniors have ERIC kits.
Okay.
And if they don't, they really should have one.
Okay.
Basically, it just has your personal information, your first contact, like the person you want notified.
Right.
Your list of medications, diagnoses, that kind of thing that might lead us to a potential diagnosis and how to treat you.
Okay.
And then also having, if you have what we call a DNR, or a do not resuscitate certificate, which is something that needs to be signed by you, your family, and your doctor. That's good to have that handy. In the ERIC kit is great, but if you don't have it in the ERIC kit, it's good to have it in someplace accessible, like the fridge.
I see.
Yeah.
Where could a person get an ERIC kit?
So you can get it from Seniors for Seniors.
Okay.
And if you don't have one but need one, and let's say we come to you and you don't have one, we have some in the truck that we can give out.
Okay.
Yeah.
Yeah, I know in Souris they do have a Seniors for Seniors here, so that is awesome that if anybody would like an ERIC kit, they can reach out to them and get one.
And it doesn't need to be just seniors, it can be anybody with chronic health issues.
Yes.
So,
yeah.
And it kind of just gives us just a kind of a condensed version of, so you don't have to say it all. And also if you're not able to tell us, then we can just read it and see, oh, okay, they've got this problem, this could potentially be the issue.
Right.
So
just leads me just to something about definitely a person would want to maybe list their allergies.
That too,
there, or get those medic alert bracelets.
Yeah, those are very handy too.
If they have an allergy to, maybe consider having one of those on for themselves.
Yeah, and it's great if you have children that have health issues or have allergies.
Right.
It's great to have those written down too as well. I've seen these advertised where for children they can actually have seatbelt covers that show like the kid's name and then any potential diagnoses they have.
Right.
So if you're in an emergency, you're in a car accident and the parents can't tell us anything, then we can read on that and see, this child has this problem.
Yeah, that's a great idea.
Yeah.
Wow, there's certainly a lot of things that you need to remember as going out into the public to help out, and just things that we as the public and people can do to help prepare our homes and be prepared in the event that you may have to come to our home to help out.
Yeah.
Is there we sure talked a lot about a lot of things. Is there anything that we may have missed that you would like to share with our listeners?
Just kind of in the aspect of being short-staffed, it unfortunately sometimes that means we have a longer transport or a longer time to get to you, depending on where we are. Right. Because we're not necessarily in the station, and so the next closest unit might be an hour away. Right. So just being patient with us.
Yes.
It's really great. We get to you as fast as we can, but naturally, distance plays a big factor in when you're in a rural area.
Absolutely. Yeah. There's definitely the 45 minutes to hours, especially in between towns, even from just Souris alone. I think about driving to Deloraine, it's 45 minutes, or, just some of those different areas. So, you can't be everywhere.
Yeah, unfortunately not. We try our best.
Absolutely.
Yeah.
So sometimes I just see the ambulance and driving just around town. I wonder sometimes, are you... Of one time, I remember they used to stop kids that didn't wear helmets when they were riding their bikes, and just giving that little bit of education. Are those sort of things that still happen?
Not while I've been working here. But I mean, we typically just kind of drive around, make ourselves kind of create a presence. So, so people know that we're here, and it's like, hey, we're here to help, and we're usually just kind of get out of the office and
that too, and it's just it's reassuring for me to just even see that and just you're right, the presence and knowing that in an emergency there's people here to help us.
And we do enjoy it when kids are like
Wearing the
Unfortunate-
helmets?
Not the ones wearing helmets, but but unfortunately we can't flick the sirens, but we
no.
will do the lights.
I see.
Yeah.
Okay, well, good to know. Maybe
Yeah.
I'll try it one time.
There you go.
Well, it's been a pleasure having you here, Hayley. I
Thank
think
you
it's
for
really
having me.
important that this kind of information is, shared with everyone on a regular basis. So, yeah, thank you so much for
Yeah,
coming,
thank you
and
for
thank you
having
for
me.
all your work that you do.
Thank you.
This has been Spotlight on Souris for Wednesday, May the 21st, 2000.